Proficiency in point of care ultrasound can have a bearing on the outcome of patients because it helps us in making quick therapeutic decisions. And in that aspect, proficiency in POCUS is no longer the domain of the radiologist alone. Rather, every physician who is involved in acute care of the patients, be it in the ER, in the ICU, in the operating room, needs to be well versed with the various aspects of using the ultrasound to thoroughly examine a patient from the head to the toe, right? And it just not helps us in making important clinical judgment or diagnosing conditions which might have otherwise been missed in spite of a history and a thorough clinical examination. It helps us in assessing the different organ systems. It also helps us in making important therapeutic decisions. Maybe how much fluid you want to give to your patient, whether you want to start this patient on a diuretic. And it also helps us, or is an important aid in various procedures that we do, like putting in a vascular access, putting in a drain somewhere in the body, or something more life-saving like a pericardiocentesis. I can recall an elderly obese patient who came into our ICU in the middle of the night, who was actually diagnosed as ACS. I came in shock, and then I just picked up the probe and I saw that the right side of the heart was enlarged, and then the patient was too unstable and we ended up thrombolizing the patient on a suspicion of PE, and in the next 24 hours the patient made a remarkable recovery. So there was another young guy with chronic kidney disease who came in with breathlessness, and on ultrasound we found a large pericardial effusion causing tamponade, was hemodynamically unstable, and then we put in a needle, put in a catheter, and the patient made a remarkable recovery in the next 6 hours. So me, along with the rest of the faculty, will be teaching you the various aspects of POCUS in this module. Obviously, I'll be talking about the use of ultrasound in fine-tuning of mechanical ventilation, how to assess the diaphragm, checking for deep venous thrombosis, as well as some newer exciting applications of ultrasound like the VEXA scope.